Hi, my name is Rachel, and I'm a PA student at Morehouse School of Medicine. Um, for security purposes, can I get your name and date of birth?
Daniel Magistry, June 21, 1982.
Okay, thank you. All right, Daniel, so what brings you in today?
I'm doing an exam for my physical exam for my job.
Okay, all right, that's nice. What kind of work do you do?
I'm a data analyst.
Okay, well, that sounds really cool. So we'll go ahead and get your exam done, and then we'll get you in and out. How does that sound?
Sounds good.
Okay, perfect. So today what we're going to be doing is an abdomen exam as well as a peripheral vascular system exam. So the first thing that I'm going to need from you is to go ahead and take your shirt off, and then we will go ahead and drape you with our drape here. And then I will also pull this out so that you can lay your legs straight across. You can go ahead and lay down for me. All right, so I'm just gonna drape you here so that your abdomen is still exposed, but we just have you covered up. Okay, can you go ahead and rest your hands to your side for me? Perfect. All right, so the first thing I'm going to do is I'm going to go ahead and inspect your abdomen. I'm taking a look at your, for any discoloration, any scars or any dressings that you may have on your abdomen. I'm looking for swelling or bulging, any pulsations or any movements that you have. I'm also taking a look at your umbilical ring, and then just any scars. And so far, that looks pretty good. So the next thing that I'm going to do is I'm going to go ahead and listen to your abdomen, okay? I'm going to go ahead and wipe this down. So it may, I'm going to wipe my stethoscope down. It may be a little cold, so excuse me in advance if it feels just a little cold for you, but I just want to get it nice and clean before we get it on you. How does that sound?
Sounds good.
Okay, good, thank you. Alrighty. Okay, Daniel, so what I'm going to do, I'm going to just place it into 4 areas. I'm listening for normal bowel sounds, okay? All right, here we go. So I'm going to start off in the right upper quadrant. Then I'm going to go to the left upper quadrant. Now I'm moving down to the lower left quadrant. And then your lower right quadrant. Okay, and while I'm here, I'm also going to listen for any stenosis. Normally I would listen for 2 different vessels, but today we're only going to listen to 2, and that's the aortic vessel and then your renal vessel as well. All right, so this is the aortic. We'll move down, and this is the renal. Okay, Daniel, so the next thing that I'm going to do is I'm going to percuss and palpate. Do you have any pain anywhere in your abdomen that I need to know about before we start that part?
No.
No? Okay. Alrighty, because if you did, then we would go ahead and save that for last. So the first thing I'm going to do is I'm going to percuss. I'm just going to put my fingers on your different areas. I'm just going to tap them, and then I'm just listening for tympani. Okay? And that's in your right upper quadrant, your left upper quadrant. I'm moving down now to your left lower quadrant, and now your right lower quadrant. Okay, good. All right, so I'm going to palpate, and I'm going to do it twice. The first time I'm going to palpate lightly, and then the second time is going to be a little bit of a deep palpation. Are you ready?
Yes.
Okay, perfect. So again, starting in the same pattern that we've been doing. This is the right upper, a light palpation, the left upper, moving down to the left lower, and now back to the right lower quadrant. Okay, all right, and I'm gonna just go in a little bit deeper, okay? All right, so palpating here, deep palpations in each 4 quadrants. Okay, all right. So what I'm going to do next is I'm going to go ahead and feel for your liver, for your kidney. So I'm just coming back around here. I'm going to do this. This is on both sides. I'm feeling for your kidney. I don't feel them, so that means that's a good sign. All right, now I'm going to do a hook maneuver here to feel for your liver. Okay. That doesn't hurt or anything, does it?
No.
All right, perfect. Okay, I don't feel your liver, so that's good. While we were here on your liver, the other thing we would do is to check the span of your liver, but we're not going to do that today, but I will tell you how we would normally check for the span of your liver. Using the mid-sternal line, I would go from the abdomen, from the bottom up, and I would percuss, like I did earlier, and I would be listening for sounds, timpani sounds. I would percuss until I get up and I hear your sound goes from timpani to dullness. And then I would go ahead and mark where I first heard dullness coming up from the abdomen. Then I would go from the upper borders and I would also percuss. But this time I would be hearing resonant sounds, and then I would keep on percussing down until I hear dullness sounds. Then I would go ahead and measure where my two markers are. And I would also know that the limitations for the mid-sternal line is 4 to 8 centimeters. And that is a normal liver span. So that's how we would normally do that test, but we're not doing that today. So the other thing that I just want to do is I want to go ahead and feel for your spleen. Can you go ahead and take a deep breath for me? Okay. Good. All right. I don't feel your spleen, so that means it's not enlarging. Okay, so I just need you to sit up for the next part of this exam. And I'm going to move here to your back, Daniel, where I'm going to be checking, I'll be checking for any renal, I'll be checking for any renal tenderness that you may have here. Okay, Daniel?
Okay.
Alrighty, so I'm just going to place my hands on your back and I'm just going to tap. Let me know if you feel any tenderness there. Okay?
Okay.
How does that feel?
Normal.
Okay. Okay, thank you, Daniel. All right, Daniel, can you scoot all the way back here for me, please? And then just go ahead and put your legs up here. Both of them for me. All right, so we're done now with your abdomen portion. So now we're going to do your peripheral vascular system. I'm going to first start off with, I'm going to go ahead and check the temperature of your upper extremities. Can you just hold your hands out for me? And I'm just going to go ahead and just, lightly touch just to make sure that your temperature feels fine and normal.
Okay.
On your arms? Okay, good. Thank you. And now I'm just going to take a quick look at your fingers. Just hold those out for me again and flip them over again. Okay. And I'm going to go ahead and do what's called a capillary test. I'm pressing your nail bed and just making sure that that color comes in. Okay. Yep. We can see that your color is filling back up, right?
Mm-hmm.
Yeah, so that's good. I would also do that on your feet as well. You can go ahead and relax your arms. I would normally do that on your feet, but today we just won't do it on your feet. Okay, so now I have two arteries that I need to just go ahead and check your pulse. Can you just kind of slightly hold your hand out again? All right, I'm going to check first for your radial artery. I'm going to do that on both sides, and then I'm also going to check your brachial. Can I get this one? Good. And then now we're going to check your brachial. Okay, good. All right, so your skin looks good. The size of your wrist looks fine. Doesn't look like you have any edema or anything like that going on, so that's good. I'm going to move your drape up just so I can see your legs a bit. Is that okay?
Sure.
Okay. And we would also normally check your femoral artery, which is in your upper thighs, but we won't do that for this exam.
Okay.
So I'm going to check three arteries down here, which is your popliteal, your dorsalis pedis, and then your posterior tibular. You do have socks on. Normally, for me to do an accurate pulse check, we would need your socks off. But we're just going to verbalize it for today, what we would normally do. So let me go ahead and check your popliteal artery. Can you kind of pop your knee up for me just a little bit? Okay. Thank you. Let me listen. I'll feel on this side as well. All right. I'm just going to go ahead and do a quick listen here. Seems like my next patient is a little antsy and just wants some attention. So we've got to get wrapped up here pretty fast. Okay. All righty then. So that would do it. Again, we would go ahead and we would do your dorsalis pedis, which is here, and then also we would check your pulses here. So I'll just do one more thing before we go. I'm just going to roll down your socks, and I'm just going to check for temperature on your legs. Okay, and I'm just feeling your ankles. I don't feel for any edema or see any. Doesn't look like you have any swelling. Seems like all of your arteries are working really well. Do you have any questions for me, Daniel?
Not at this time.
Okay, well, thank you. I'm going to go ahead and step out and see about my next patient here. You can, as soon as you get dressed and you're free and you're ready to go.
Okay, sounds
Okay,
good. Thanks.
thank you.